and welcome to Hari Gastro. In today's video, we're going to be talking about a very common and interesting childhood disease, which is called hand, foot, and mouth disease. So let's get started. So what is hand, foot, and mouth disease? Hand, foot, and mouth disease is a mild but contagious viral infection, which is most commonly found in younger children, especially those under the age of 5. But the disease can affect people of all ages. The disease is characterized by ulcers in the mouth and a rash which occurs on the hands and the feet. The virus that usually cause hand, foot, and mouth disease are named Coxsackie virus A16 and enterovirus 71. So from this definition of hand, foot, and mouth disease, we get that it's a common viral infection which most commonly affects kids under the age of 5, but adults can actually also get the infection. And the disease is actually most commonly caused by two specific types of viruses, and that's the Coxsackie virus A16 and the enterovirus 71. So the main manifestation of this disease is actually these mouth ulcers or sores, which occur on the inside of the mouth as well as on the surface of the upper and lower lip. In addition to this mouth aspect, we also have these red raised papules, which occur on the palms of the hand as well as the underneath of the feet. And this is why the disease is given this name, hand, foot, and mouth disease, because the main manifestations of the symptoms actually affect the mouth, the hands, and the feet. So now that we know what the basics of hand, foot, and mouth disease is, let's take a closer look at how one can contract this disease. So hand, foot, and mouth disease is often caused by a strain of Coxsackie virus, most commonly Coxsackie virus A16 and the enterovirus 71. So these viruses can easily be spread from person to person through saliva, fluid from the blisters of the sores, in the feces of the infected patients, like when someone changes their diaper, or even in the respiratory droplets which are sprayed into the air after they sneeze or cough. So as we can see, these are the various ways in which the virus can be spread. So it can actually be spread through the saliva from person to person, and the uninfected child can become infected in this way. It can also be spread if someone comes into contact with the fluid from these blisters. So if someone actually touches one of these blisters, like in a kindergarten, if one child touches the infected blister, they can actually contract the disease in this way. The disease can also be spread in nasal droplets, so viral nasal droplets, which are sprayed into the air and onto the uninfected child through coughing or sneezing. And also, the disease can be spread to a parent or a guardian through the fecal matter, and this can occur when changing a diaper, etc. So these are the various ways in which someone can actually contract the hand, foot, and mouth disease. So now that we know how one can contract the disease, let's take a closer look at some signs and symptoms of this disease. So the usual period from the initial infection to the onset of the signs and symptoms is called the incubation period, and this takes roughly 3 to 6 days. So the signs and symptoms of the hand, foot, and mouth disease include a fever, a poor appetite, a sore throat, a headache, irritability, painful red blisters in the mouth, and a red rash on the hands and the soles of the feet. So if we take a closer look at this image on the right side of my screen, we see what this vesicular papular rash actually looks like on the hands and the feet. So as we can see, they're red, they can be raised and even painful, and they occur on the palms of the hands and the soles of the feet. And of course, we also have these painful red blisters which occur in the mouth, and these are ulcerations of the oral cavity, and they can be called oral enanthem or hypangia of the mouth. So these are ulcers which occur in the posterior oral cavity that are called hypangia, and oral enanthium are the ulcers which occur in the anterior oral cavity. So on the cheeks, on the side of the cheeks, on the gums, etc. So as is mentioned in this little word bubble, the same thing is mentioned here. So clinically, patients will also have mouth or throat pain, and children who are able to speak will tell us about their throat pain or their mouth paining. There will be a refusal to eat from nonverbal children, so they will not want to intake any food. These kids will have a fever, and the prodromal symptoms are usually absent. So now let's talk about the diagnosis of hand, foot, and mouth disease. So the physician can tell if the child has hand, foot, and mouth disease based on the symptoms the parents describe, and by looking at the child's characteristic mouth sores and the rash on the soles of their feet and the palms of their hand. So depending on how severe the child's symptoms are, the physician may also collect throat swabs or stool specimens and send them to a laboratory to determine which virus caused the illness. So usually, a clinical diagnosis can be made based on the history of the patient. So the parents may tell us about a fever, irritability, a difficulty in feeding, a sore throat that their child may have complained of. And then we can also examine the child and look for those characteristic mouth ulcers, and of course that vesicular papular rash, which occurs on the palms of the hands and the soles of the feet. And if we want to confirm the diagnosis, or we are unsure of actually if it is a positive hand, foot, and mouth disease, we can collect throat swabs or even stool specimens and send them to a laboratory and look for that specific Coxsackie virus A16 or enterovirus 71, which can help confirm the diagnosis in these patients. And finally, let's talk about the treatment of hand, foot, and mouth disease. So in the majority of cases, the infection will go away without any treatment within 7 to 10 days. But if the child is brought to the hospital within this time, the treatment of the disease may be done with prescription or over-the-counter topical ointments to soothe the blisters and rashes, pain medications such as acetaminophen or ibuprofen to relieve headaches, medicated syrups or lozenges to ease painful sore throats, and the swishing of warm salt water around in the mouth may also help relieve the pain associated with the mouth blisters and the throat sores. So this is usually recommended several times a day or as often as needed. And that brings us to the end of this video on the hand, foot, and mouth disease. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.